Imagine a tiny mosquito bite turning into days of intense pain, high fever, and body aches so bad it's nicknamed breakbone fever.
That's dengue, and right now in 2026, it's making headlines again.
But here's the good news. Knowledge is your best defense.
Stick with me today. We're diving deep into what dengue really is, the warning signs to watch for,
How it's spreading in the US and even parts of Europe, the latest on vaccines. And, most importantly, simple steps you and your family can take to stay safe.
By the end, you'll know exactly how to protect yourself this summer and beyond. Let's jump in!
Dengue is a viral illness spread by certain mosquitoes, mainly Aedes species, the same ones that carry Zika or chikungunya. There are 4 related dengue viruses, so you can get infected more than once. Not everyone who gets bitten gets sick. About 3 out of 4 people have no symptoms or very mild ones.
But when symptoms appear, they usually start 4 to 10 days after the bite and feel a lot like a bad flu.
You might get high fever, often 101 degrees Fahrenheit or higher, severe headache, especially behind the eyes, muscle and joint pain, that's where breakbone fever comes from. Nausea, vomiting, a red blotchy rash on your skin.
If you've traveled to a warm area recently and feel these symptoms, see a doctor right away.
A simple blood test can confirm dengue. Most people recover in about a week with rest and fluids.
But stay tuned. We're about to cover what happens when it gets serious and why early action matters so much.
About 1 in 20 people who get sick develop severe dengue, and that's when you need emergency help fast. Warning signs include very bad stomach pain, constant vomiting, bleeding from the nose or gums, feeling extremely tired or dizzy from low blood pressure, swelling in the belly.
Groups at higher risk for severe dengue include young babies, pregnant women,
older adults over 65, and anyone who's had dengue before, because a second infection can sometimes be more dangerous. There's no specific medicine to kill the dengue virus. It's treated by managing symptoms. For mild cases, drink lots of fluids, take acetaminophen for pain and fever, and rest. Avoid ibuprofen or aspirin, as they can increase bleeding risk. Severe cases often need hospital care with IV fluids and close monitoring until the fever breaks, usually in 3 to 5 days. As of February 2026, no major outbreaks in mainland EU/EEA, but experts warn the risk could grow in warmer months if mosquitoes spread further. Outermost regions like French Caribbean islands report cases regularly. Dengue doesn't jump directly from person to person. It spreads when an infected Aedes mosquito bites someone with the virus, then bites someone else. Travelers can unknowingly bring the virus home. If you're infected abroad and get bitten by a local mosquito in the US within about a week, that mosquito can spread it further. In the US, most cases are travel-related, but limited local transmission happens where Aedes mosquitoes live, especially in warmer states and territories. As of early 2026 data covering 2025 full year and recent reports, over 5,000 dengue cases were reported in U.S. states and territories in 2025, mostly travel-associated. Territories like Puerto Rico, over 3,000 local cases in recent years, ongoing risk. U.S. Virgin Islands and American Samoa see the highest local spread. In the continental U.S., states like Florida, California, Texas, Arizona, and Hawaii have reported local cases in recent seasons. Globally, the Americas saw a huge drop in 2025 compared to the 2024 record, over 13 million cases. But early 2026 shows an uptick again, over 120,000 suspected cases in the region by late January. Now for Europe, dengue isn't common there, but climate change and travel are changing things. In recent years, sporadic local cases appeared in southern countries, like France, dozens of cases, Italy, and Portugal. As of February 2026, no major outbreaks in mainland EUEA. But experts warn the risk could grow in warmer months if mosquitoes spread further. Outermost regions like French Caribbean islands report cases regularly.
Excited yet? Next, the vaccine situation!
Is there a vaccine? Right now in the US, the only approved dengue vaccine, Dengvaxia, has been discontinued due to low demand. Remaining supplies expire around mid-2026, and it's only for certain kids in high-risk areas with prior infection anyway. No broad vaccine for travelers exists yet in the US, though research continues worldwide.
So prevention is key, and it's straightforward. The CDC's top tips work for dengue and other mosquito diseases.
Use EPA-registered repellents with DEET, picaridin, IR3535, oil of lemon eucalyptus, or PMD.
Wear long sleeves, pants, and permethrin-treated clothing. Fix screens on windows' doors. Use air conditioning when possible.
Sleep under treated bed nets if needed. At home, dump out standing water weekly. Empty buckets, tires, flower pots, bird baths, anything that holds water where mosquitoes lay eggs. These simple habits make a huge difference, especially during warmer months or travel to risk areas. Dengue is serious, but it's preventable, and most cases are manageable with quick action.
Share this video with friends and family who travel or live in warmer spots.
Smash that like button! Subscribe for more health updates! That keeps you safe! Health rocks!
And comment below. Have you ever dealt with mosquito-borne illness, or what's your top prevention tip?
Stay protected, stay informed, and I'll see you in the next video. Take care!
This video is for informational and educational purposes only. It is not intended to be, and does not constitute, medical advice, or a substitute for professional medical diagnosis, treatment, or advice.
Dengue symptoms and management can vary, and severe cases require immediate medical attention.
Always consult a qualified healthcare professional or doctor for personalized advice, especially if you experience symptoms or have concerns about dengue or any health issue. Do not rely on this information alone for diagnosis or treatment decisions. Seek prompt medical care if needed.